friends, Assalamu alaikum and welcome back to my channel. I am Dr. Maryam Hussain and I make videos related to dentistry and medicine. So today's topic is lingual orthodontics, which is one of the approaches to aesthetic orthodontic treatment. I've also made a video on aesthetic orthodontic brackets, their types, their advantages, disadvantages, and which one of them are preferred nowadays, which one of them are not, and why. So make sure you watch that video and I'll share the link in the description box. So let's begin with today's topic. System which is bonded entirely onto the lingual aspect of the teeth. It has nothing to do with the labial aspect, as in in the regular orthodontics we bond the brackets to the labial surfaces of the teeth. So contrary to that, the lingual orthodontics is restricted entirely to the lingual aspect. So I'll be discussing the advantages and disadvantages in this video. So let's begin with the advantages. The first and the major advantage why anyone would go for lingual orthodontics is the aesthetics. It is the most important one. As the labial surface is very crucial, labial surface and especially the labial surface of the upper incisors and upper anteriors is crucial to aesthetics. So as we have everything limited only to the lingual surface, so aesthetics are excellent in this case. Second advantage is that there is no risk of labial enamel decalcification. Now everything, as I mentioned before, is bonded onto the lingual surface. So it means that we need to do all the procedures, for example, all the etchings, the bondings, the curings onto the lingual surface. We are not going to etch the labial surface, so there is going to be no decalcification or demineralization as a result of etching. So first reason is that there is going to be no etching on labial surface, so labial enamel decalcification can be prevented. Second is that as the brackets are no longer onto the labial surface, there is no risk of white spot lesions onto the labial surface. So no decalcification due to caries. So no white spot lesions onto the labial surface. Third point is that the position of the teeth can be better observed. Now the labial surface is completely free and you can properly see and observe that how far the teeth are placed labially or lingually, and what is the alignment of the teeth, and you can properly observe each and every details because it is not obscured by the appliance anymore. So the fourth and the advantage that needs to be explained, and it is a kind of conceptual advantage, is that we can get the bite plane effect through lingual orthodontics, and it is very important in treating the patients with deep bite. So I'll make a diagram to explain that to you guys. So for example, while looking from the proximal side, imagine this is the upper central incisor and this is the lower central incisor, and here we've bonded bracket onto the palatal surface of the central incisor, and here we've bonded bracket onto the lingual surface, as we're talking about lingual orthodontics. So now when the patient closes the mouth on posterior teeth, this lower incisal edge is going to come into contact with the bracket that is applied onto the palatal surface, and this will limit the overclosure of the mouth, and hence it is very important to treat the patients with the deep bite. As we all know that what happens in the deep bite is that, for example, this is the central incisor, upper central incisor, and this is the lower central incisor, and when the patient closes the mouth, there is an overclosure. Like this is the overclosure, more vertical overlap than 2 mm. Normally it is 2 mm, and if it is greater than 2 mm, then it is a deep bite case. So in order to treat this case, what we can do is that we can use lingual orthodontics. I hope that is clear now. So let's move on to the disadvantages. So the first disadvantage is that there is going to be speech alteration and tongue discomfort. We know that a lot of sounds are produced by the tongue tip touching onto the palatal surfaces of upper incisors, and many sounds are produced. So there's going to be speech alteration, obviously. And then the second thing is that there's going to be tongue discomfort. For example, everything is bonded onto the onto the lingual surfaces, and it is coming into contact with the tongue, so it is obviously going to cause the tongue discomfort. Like there is initial discomfort in the regular orthodontics as well. When you apply the brackets onto the labial surfaces, it basically irritates your labial mucosa, and there is going to be a kind of ulcerations in the initial stages. So likewise, there is going to be the tongue discomfort in the initial stages as well. And also there is going to be difficulty in mastication. Now, this procedure of lingual orthodontics is very technique sensitive, because everything you're doing is to be done in indirect way. Like you're going to do everything in an indirect vision. So due to that, it is going to increase the chair time, and it is also going to increase the operator proficiency. Like you need a lot of skills to do that. And also, as a result of this, it is going to lead to increased cost, so it is going to be expensive. So now talking about the next one, there is also going to be difficulty in maintaining hygiene, as the patient cannot properly see the braces, the lingual surfaces, so he doesn't know in which areas there is like a food impaction. So as a result of that, the patient is not able to focus on the hygiene maintenance onto the lingual surfaces. And also generally people usually do focus only onto the labial surfaces, because those are the surfaces that are visible to like other people. So they're really conscious only about how their labial surfaces appear. So this is going to be leading to difficulty in difficulty in maintaining the hygiene. Now moving on, there is going to be increased bracket loss, as I explained it previously. For example, this is the upper central incisor and this is the lower one. Here is the palatal bracket and here is the lingual bracket applied. Now when the patient is going to close the mouth, this incisor edge is going to come into contact with this bracket, and it might remove the bracket when the patient tries to close the mouth. So as a result, there is going to be increased bracket loss, and then again rebonding, and entire procedure is then going to be again in the indirect vision. Okay, now there is going to be the initial alignment is basically going to be very difficult in this case, because inter-bracket span is entirely reduced when you're going to apply the brackets lingually, as compared to when you apply them onto the labial surface. Now I'll explain this to you guys with the help of a diagram. Okay. So for example, these are the lingual surfaces of lower incisors, and these are the labial surfaces of same incisors, and here I've applied brackets. Okay. So interbracket span is a span or the distance between the two brackets. Now this is the lingual surface of lower incisors, and this is the labial surfaces of the same lower incisors. Now the distance between the brackets of lower incisors on the lingual surfaces is going to be less, as compared to when the braces or the brackets are applied onto the labial surface. This distance or the interbracket span is going to be more. So in case of lingual orthodontics, this span is reduced, this interbracket span is reduced, which is going to lead to the problems with the initial alignment. So in light of everything that I discussed before, because of these advantages, because of these disadvantages, what we're going to do is that we are going to use the lingual appliances onto the upper arch, because we are more concerned about aesthetics in upper arch. Aesthetics are more crucial in the upper arch only, and we're going to use lingual appliances. We are going to use the labial appliances, or we are going to prefer labial appliances in the lower arch. Why? Because we can minimize the tongue discomfort and speech alterations. We can also minimize the difficulty in mastication and a lot of more disadvantages. So we are going to prefer lingual appliances in the upper arch so that aesthetics can be maintained, and the labial appliances in the lower arch so that we can avoid their major disadvantages. So that's it for today's video. I hope I made myself clear to you guys. Thank you for watching and have a nice day. Make sure to subscribe my channel for more upcoming content, and like this video, share it with your friends, and stay tuned for more amazing content.